The LGBT community is one of the most vulnerable communities in the face of prejudices and negative attitudes. Professor Sava's current research aims to develop an internet-delivered prevention program based on acceptance and commitment principles. The program will help younger generations to cope with adverse events through self-acceptance and personal agency. At a national level, Professor Sava's solution promises to drive the adoption of anti-discrimination policies and the reduction of stigma surrounding the LGBT community. Keep watching Research in the Spotlight to discover how an experimental approach plans to improve the lives and the protection of the LGBT community. Currently, you are implementing a collaborative research project funded under the Norway Grants. Which has been the main trigger when you started this project?
The main trigger was a social one. A couple of years ago, there was a political event in Romania in which people were asked to come to vote for wrong law, I would say, which was to forbid people who to marry with. And in my opinion, that was wrong, not just because we are humans and we all have equal rights, but also from a scientific perspective, because I knew a lot of studies before, meta-analysis done, and for instance, people who are homosexual or lesbian and who adopted a child, their children were equally happy and mentally healthy as children raised by other families, by, let's say, traditional families. And also because what I knew, it's the thing that mattered the most is the acceptance. If a child is raised in a homosexual, by two homosexuals or by two lesbians, and has some mental health difficulties, most of the time this happens because the other children are bullying that person or saying nasty things about that individual, not because it's an unhealthy environment at home. So this kind of law that emphasizes that some people has something wrong about them would not do anything else than to perpetuate and even increase the stigma that is associated with this kind of sexual preference, for instance. So the main trigger was a social trigger. I'm not usually a specialist in this field. My other activities are in mental health area mostly, but I felt that it's our duty to do something also from a social perspective, not only to publish articles.
Are there any partial results that you'd like to share with us so far?
Yes, in Work Package 1, which is one of our main directions in the project, we looked at a comparison between Norway and Romania in terms of the social inclusion of the LGBT community. We also looked at some predictors. So what causes a certain individual or a certain group of individuals to accept the LGBT community more rather than others. And we saw that, for example, gender is a very important predictor. Males are generally less likely to be inclusive of other individuals. Education is also a very important aspect, where higher educated people are more likely to accept LGBT individuals. And religiosity is also a very important aspect. But we also conducted a survey, a national survey, using the telephone interviews, where we found that, again, gender is a very important aspect. If we look at the results, for example, females are much more likely to feel closer to the LGBT community rather than males. People, again, who are higher educated, so have a bachelor's degree or a master's degree or a PhD, are more likely to be inclusive of the LGBT community. We also a very surprising thing is that 44% of the Romanian population that we surveyed said that gay couples are just as good as parents as other couples, which is a very large percentage, especially comparative to looking at what they consider justifiable actions and what they consider non-justifiable actions. For example, if we look at homosexuality, 38% of the males we surveyed, think that homosexuality is never justifiable under any circumstances. So again, these results are very interesting, and we are looking forward to seeing why we see such results, which is the second part of our project.
Which is the social impact of your project?
I was mainly responsible for work package 3, which was actually aimed to develop an intervention program for the LGBT community. We based our program on an acceptance and commitment therapy framework, which is evidence-based approach to managing emotion and to reducing anxiety and depression. And we adapted those principles to the specific needs of the community. The program was delivered online, and we managed in the end to include 20 participants who follow the program from the beginning to the end. The program was about 6 weeks long, and participants had to read some online materials and to do some homework where they were encouraged actually to let's say try different acceptance strategies, try to diffuse themselves from negative thoughts, try to clarify their values and to eventually act according to their values. We just received the results. We had a preliminary analysis, and the results were pretty encouraging in this respect. So from the beginning of the program until the end of the program, both anxiety and depression decreased significantly, and acceptance, for example, increased. So it seems that once participants were enrolled in the program, that worked for them. On the other hand, we must admit that we initially aimed for a larger crowd, let's say, and it would have been very good to have this in our results, but probably we've learn a few things related to how we could better, let's say, present the program to the community, and hopefully in the future we can do that to a larger extent. So speaking or relating to the social impact, what we have in this program is that we do have the manual, the intervention manual, that will be available for the public. We do have the online platform.
Well, to begin with, I would like to say that LGBTQI plus people in Romania have no rights whatsoever. So what we aim to do is to work for a more inclusive world, to work on visibility, because this group of people are not represented as they should be. They have no legal recognition in Romania, and of course they do have needs, specific needs, and no one really takes care of that. So what we would like to achieve by this program and by researching the community and all that is to also make space for the LGBTQI plus community, because we should have more, like specific laws. Everyone is equal, but not in terms of law. laws, and this is what we aim to do. This is the social impact that we want to have. There are, of course, NGOs who work for this, but it's also good to have your work backed with research and to have like data that says that this is indeed a problem and there are a lot of needs that need to be covered.
We are discussing a collaborative project involving a team of researchers with various backgrounds and an international partnership with a prestigious university in Norway. What does it mean to you and the team you coordinate such a partnership with, and what are the benefits?
So we are working with University of Bergen, which is a very prestigious university, both in Norway and internationally. And one of the main benefits of working with the University of Bergen is their expertise regarding LGBT topics. They have extensive expertise in this domain, and we have benefited greatly when collaborating with them. They also bring a lot of experience regarding implementing national surveys. We haven't had much experience regarding that. And I think that the networking aspect of this project is very important, both for our team and for the university for West University of Timisoara.
We have a very good cooperation with University of Bergen. We found there a professor, whose name is Norman Andersen, and he is a well-known expert in LGBT plus issues. And the idea of the project was to bring their expertise in these subjects with our expertise in mental health issues and to try to design a grant that not only tackles these kind of social issues like how much do you agree with people having a different sexual orientation, but also to provide programs. And we developed two programs, one for the target group, LGBT plus community, and the other program for teachers. And based on this kind of work, we want to increase the quality of life of people in Romania in general, but also from LGBT community as well. And the cooperation works very well. They are a great team there. We learned a lot from Norman, from the LGBT issue perspective, and I hope he also expanded his interest in the topic. And I'm particularly talking about the mental health program and the teacher program because they were not familiar necessarily, or they didn't do this kind of work before. Most of the work they've conducted was mostly either developmental work, looking longitudinally how things change in times for the LGBT people. But with this kind of program, we went one step further to interventions.
What should people remember about your project after listening to this podcast?
The most important things is we'll have a photography how the things are in Romania in 2022, for instance, for LGBT issue and in general. I think from this perspective is the most ambitious project and most ambitious photograph that has been taken so far. Secondly, we have a evidence-based program for preventing mental health issues that has been conducted, and it will be available for free for specialists that are interested in spreading and upscaling the benefit. And thirdly, I think we will have a program for teachers to know better how to tackle these sensitive issues in high school, because it's the most common place where people could be bullied, and then suffering because of that.
Thank you for watching Research in the Spotlight, a podcast for scientists and passionate science people made under the Norway Grants research program by the Executive Agency for Higher Education, Research, Development and Innovation Funding as program operator. Until the next time, like and share this episode if you think science is a key to a better future.